Welcome to our third and last video. It's all about better sex. So we're addressing physical issues around sex. I want to take a moment here to talk about this new sexual revolution, especially for women. As we know, there's this long of a list of drugs for men, and there's not even a list at all for women.
Well, first of all, Julie, thank you for bringing up the subject because it is something that to this day remains somewhat taboo to talk about it. And it's time for women to break this taboo, to talk openly about their concerns about sex. In my 10 years of practice, I've had the chance to speak to thousands of women about their most difficult, intimate challenges. And it's important to be able to talk about these things. So I'm happy we're having this conversation today.
Me too. I'm thrilled. And this first and foremost was to really take in charge, and we wanted to empower women and say, you know, I am allowed to have this too, right?
Absolutely. So you're talking about the sexual revolution, or this new sexual revolution.
Yes.
Talk about the first revolution back in the 1960s with
the
birth control pill
Yep.
and abortion. And so it was okay at that time for women to have sex or want to have sex for sex.
Right.
And now the sexual revolution is about women wanting better sex, and that's okay.
That's okay. Absolutely.
That's absolutely okay. So you were mentioning about the whole list of drugs for men to improve their libido and their orgasm, etc. Well, yes, now in Canada, very recently, there have been drugs approved for women's libido, and one specifically for premenopausal women. And for the first time in Canada, there is a hormone replacement therapy that is available that includes a testosterone derivative supplement within it, so including estrogen, progesterone, and testosterone for the very first time. That's been around in Europe for 30 years and now finally available for women in the later stages of life.
Okay, but we're not going to be late on this one. So can we talk about the first treatment? Let's talk a little bit about the O-shot.
Yes.
So from what I understood, it's a bit like having a vampire facial, like a PRP.
Yeah, so PRP has been around for a few years. So it's used for different things, including sports injuries, used for hair growth and for the face, and also a new application for the O-shot, so for the clitoris, actually.
Okay, so you're telling me I'm going to get a shot in my clitoris?
Well,
how does it work? I need more info here.
Right, so this procedure is an office-based procedure. And basically, how it works is blood is drawn, spinned, centrifuged, and this plasma is injected back into the clitoris after numbing anesthesia, of course.
So the procedure takes about, what, like 20 minutes, let's say?
The whole thing is probably about 20 minutes, half an hour, but the injection is just a few seconds.
Okay, so not that bad.
No, not that bad.
And it doesn't hurt because?
It's under anesthesia.
Okay, perfect.
So this will stimulate growth factors and regrowth of nerve endings and vascularity, etc., in the clitoris.
For the O-shot, who would be a good candidate? Who would come and get that type of treatment and why?
So many women will have experienced orgasm younger and find that with time they feel less intense orgasms or not able to achieve orgasm at all with age. And so this treatment will help revive that sensation.
So what should they expect as an effect? So I'm guessing more sensitive, longer.
That's right. More intense.
More intense. Frequent. Multiple.
That's right.
Sound all good? All of the above?
All of the above.
Okay, great. Dr. Buzaglo, please correct me if I'm wrong, but just from my inner circle, I think it's an issue that is pretty common. Am I right?
Well, in general, sexual dysfunction will affect most women at one point in their life. In general, about 40% of women will suffer from some sort of sexual dysfunction in the premenopausal years, and 60% after menopause. And
so much to look forward to.
Well, it's normal for women to want to have sex in the later parts of their life and to enjoy it.
I also heard about the G-shot. So there's two kinds of shots, the O-shot and the G-shot.
Right.
So the G-shot will be
In the G-spot.
In the G-spot.
The G-spot, which is still controversial, even
Okay.
amongst gynecologists. Does it exist? Does it not exist? We know it exists.
Okay.
And is a specific area that is very, very sensitive, a neurovascular bundle in the anterior vaginal wall, probably midway between the pubic symphysis and the cervix. And it's a very highly erogenous area, and this can be stimulated. So this sensitive spot, for those who already experience vaginal orgasms, is located by the patient, and this filler is injected into that spot for increased friction and increased sensitivity from penetration.
When you do the injection, what exactly do you inject? It's not PRP.
In this case, it's hyaluronic acid, so
Okay.
it's a filler. So just like filler that women would put around the lips, for example, of the mouth, this filler is augmenting the volume of the G-spot. So it's more easily accessible for men, so they can better identify it, and it increases friction from penile penetration for the women for more intense vaginal orgasms.
So let me go back on something here.
Yeah.
You mentioned that it will be located by the patient. How does that work exactly?
So we have a specialized speculum. It's
Okay.
a patented speculum that opens up actually on the side. So we have access to the anterior wall of the vagina with a specific speculum. And very simply, a Q-tip is placed until the patient finds that it's the most sensitive area, and that's where the injection is made.
So that's how you locate it.
That's right.
So it's actually teamwork. It's with the patient and the doctor.
Always.
So I have many questions now. It's like it's popping in my head. I was wondering, can you combine these two treatments?
Sure.
Okay.
It can be combined in the same setting.
Oh, you can in the same.
In the same visit,
Okay.
and also can be combined with the Diva laser that we had discussed the other week.
Okay, so with the other treatment as well.
That's right, for a better overall sexual experience.
Is there a downtime after this? Can you go back to your normal activities or like your sport or?
You can go back to any activities. We usually recommend avoiding intercourse for the first 4 hours.
So Dr. Buzaglo, I asked you this in every episode. So how long would this treatment last? Like how often would you have to maintain it?
So typically for the O-shot, it lasts 12 to 18 months. Some women longer, up to 36 months.
Oh.
And the G-shot, typically 3 to 6 months.
I have a question for one of my followers. She mentioned that she's 41 years old and she lost her sexual drive. So what causes this and what can she do?
Well, this is really a very multifactorial issue. Of course, first and foremost is the psychological or biopsychological social factors, first and foremost. Many chronic conditions can affect sex drive, medications, relationship factors. Of course, all of those things will have an impact on a woman's sex drive.
I was wondering how come in 2021 we don't know about these things and we never heard about it before?
Well, you know, Julie, I have to say, in our training as OBGYNs, we hardly ever talk. In fact, I've had no training on sexuality for women,
None?
which is quite surprising. No, in fact, the only thing we had to know for our Royal College exams were the stages of Masters and Johnson about sexual excitation of women, which is arousal, plateau, orgasm, and resolution. So this is what we had to learn for our exams, and that's it. We never talked about sex.
So where did you learn and how did you do all your research and
So I sought extra training because, as I mentioned, I had a lot of women talk to me about these issues, and I really wanted to help them. And I found that I did not necessarily have the training for it, so I sought out extra training. I went to the European Society of Aesthetic Gynecology, focusing really on the functional aspects of women's sexuality, and trained over there. And I'm part of the International Society for the Study of Women's Sexual Health as an active member, and I seek different ways to help my patients achieve better sexual satisfaction.
so you're saying all this has been going on for many years in Europe?
Yes, this.
So once again, we're late to the party. Okay, well, never too late.
Never too late.
Okay,
and
great.
I'm hoping to help women with this aspect of their lives. It's hugely important.
Just to remind our people here, we can have a free consultation with you here at Victoria Park Medispa. And the consultation, like I said, is with you. Like, it's not with a technician, it will be with a doctor. Dr. Buzaglo, I want to thank you for your time. It was about time we open up about women's sex lives, the issue and how to solve them. I couldn't think of a better person to talk about this than my gynecologist, Dr. Karen Buzaglo. If any of these topics interest you, please come talk to her because you do not have to suffer in silence. I hope you had as much fun as we did, and we wish everyone better sex and better health.